So what is Aspergillosis? So it is going to be a fungal infection and which is characterized by their septate hyphae, and they are going to produce various forms of clinical manifestation, and it is caused by the species called as Aspergillus species. So whenever we are going to talk about a particular infection and their etiological organism, they have their subspecies which is going to cause infection. So we will see one by one which is the possible pathogen which is going to cause infection in our Indian setup and all over the India. So it's going to be Aspergillus fumigatus, Aspergillus niger, Aspergillus flavus, Aspergillus tereus, Aspergillus clavatus, and Aspergillus nidulans. So these particular species are those which is going to cause infection in the immunocompromised patient, and they are going to cause both systemic as well as superficial fungal infection. So what are the risk factors? So as I have told before, the common risk factors are immunosuppression, immunocompromises, or any patient who had previous episodes of pulmonary tuberculosis with cavitation. So I will show you the chest X-ray afterwards and we will discuss about it. So immunosuppression and immunocompromises, they both are different terminologies. So immunosuppression, in case if the patient is going to have anything like a transplant, like example renal transplant, the patient may be an old hepatitis C patient and may have undergone something like cirrhosis. Now it warrants an transplant. So we are going to put the patient on transplant. So post-transplant, we are going to put the patient on various immunomodulator, which is going to reduce their both cell-mediated and humoral immune response. And again, these kind of patients are more prone for opportunistic infection. So that is about immunosuppression, where we are going to go and suppress the immune response by using various immunomodulator like tacrolimus, sirolimus, or any anti-cancer drug. They are going to hamper the immune response and it's going to lead to the disease. So that's the immunosuppression. And immunocompromises, the patient may be suffering from something like primary or secondary immunodeficiency disorder. So example for secondary is going to be the diabetes mellitus and HIV/AIDS. And in case of primary, the patient may be having something like humoral immune response deficiency and cell-mediated immunodeficiency or phagocyte-mediated disorder, or anything to do with the complement protein and their regulator. So these are the patients who are more prone for this kind of infections. So that's going to the immunocompromises. And we have the old cavitatory pulmonary TB, in which the patient is going to be more prone. So here the patient would have already got a TB. So example this is going to be the lung, and the patient may be having a cavity. A particular cavity would have been produced by the Mycobacterium tuberculosis, which is going to be a causative agent of tuberculosis. So what happens is that, so this particular organism is going to cause this cavity, and this cavity is going to act like a big room where it is going to be very much moist. So this particular patient is already a TB patient, which indicates that the patient may be having an immunocompromises. So along with that, there is a room and a warm room is there. So what will happen is that when the particular patient is going to get exposed to the spores of Aspergillus, the particular spores get attached to the walls of the particular cavity and they are going to grow inside. So and they are going to grow and they are going to involve the entire area. So that is going to be the aspergilloma. So this particular thing can mimic carcinoma of lung in the radiological examinations. So this is going to be the pathogenesis of cavitatory pulmonary TB in aspergillosis. So this is what I explained, and here you are able to see a particular cavity. So this is a cavity. So this is a known case of pulmonary tuberculosis. With cavitation. So again, the particular organism, when they are going to get inspired, when the patient is going to breathe, the spores can go inside. So most of the time, our environment contains the spores of various fungi. Even we will be inhaling the fungi, but nothing will happen because our cell-mediated immune system is going to be very much intact. As I said, it's not going to allow these kind of pathogen to grow. But here, when the particular spores are going to go inside, so what is going to happen is that they go and attach to the cavity wall, and the particular organism can grow inside and can cause the entire lung, the particular cavity can get involved here. So here, the particular lesion can look like a tumor. So that's going to be the aspergilloma, which is one of the most commonest form of aspergillosis in patients with underlying tuberculosis or treated old case of tuberculosis with cavitation.